The following program is sponsored by the Medicine Center Pharmacies.
Good morning and welcome to Health Matters with the Medicine Center Pharmacy, a local Health Mart pharmacy. And I'm your pharmacist, Paul White. We're glad you joined us. Before we begin, I'd like to thank our sponsors, Mercy Medical Center, Studio Arts and Glass, and of course our technical producer, J.D. DeAngelis. In the studio with me is Brad White, who yesterday celebrated 30 years with the company. If you can believe this, he started at age 14. And he's a compounding pharmacist, and our guest from Mercy Medical Center, Dr. Maurice Chung, Director of Mercy Center of Endometriosis, Pelvic Pain, and Urogynecology. Good morning, Doctor, and welcome to the show.
Good morning. Glad to be here.
If you deal with the symptoms of pelvic floor dysfunction, you're likely facing incontinence issues, perhaps bowel issues and others. You may find it difficult talking about these problems even with your healthcare provider. However, providers, especially urogynecologists, are used to talking about these problems. Today we're going to learn more about the symptoms of PFD, endometriosis, and a host of treatment options including laparoscopic and minimally invasive surgery. We'd like to remind our listeners that our program is available on our podcast, which can be downloaded from the App Store of your favorite smartphone. You can look for Health Matters with the Medicine Center Pharmacy and take our program with you anywhere you travel, anytime. If you have questions you'd like addressed today, you can post them up on our live Facebook feed, and you can give us a call here at the radio station at 330-450-1480.
So, Dr. Chung, tell us a little bit about yourself.
Well,
or a lot, if you like.
Oh, well, there's too many to talk about, but anyway, I am a pharmacist. I am a doctor. I am OBGYN, but my specialty is in urogynecology. And so what is urogynecology? Basically, it's a specialty that is urology of the lower urinary tract, that dealing with the bladder symptom, and also the pelvic floor, such as the muscle and the organs. So when they fall out or when they leak urine, our patients. And that's what I usually take care of them. And another big part of urogynecology is pelvic pain. And that includes sexual pain, like painful sex, bladder pain, muscle pain, back pain, lower back pain. And so that's falling into the urogynecology division, which actually the term is female pelvic medicine and reconstructive surgery.
Is this common, the urinary pain with women and that sort of thing?
Well, it is so common that you just don't see it. And when patient comes through the door and start talking about their pain or the urinary symptom, the bladder is one of the biggest issues. And of course, the muscle in the pelvis. So that gives that term pelvic floor dysfunction.
Okay.
Yeah.
All right, Doctor, what conditions do you specialize in at Mercy Center for Endometriosis, Pelvic Pain, and Urogynecology?
What conditions?
Yeah.
Those are, well, it's a long story, but I try to make it simple. What is endometriosis? Endometriosis is painful menses. Many of these patients have painful sex. So they have menstrual cramps so bad. Sometimes it started even before the cycle starts, like several days to a week. And then after it's over, it still hurts. And of course, whenever they have a sexual relationship with their loved one, it hurts. And that's endometriosis. And what that means is the tissues of the inside of the uterus is what we call the endometrial layer. Those tissues usually just not spread and sheds during the menstrual cycle. However, they just spread everywhere. It's almost like a cancer, but they don't kill you, but they cause all these scar tissues, make you have trouble to become pregnant because of the inflammation they created every menstrual cycle. And oosis means...
Is it on the rise, endometriosis, or do we have it sort of handled, if you will?
Well, I don't think it's been handling very well.
Okay.
Ever since I was in medical school up until now, and there are some progress. But still, these patients are still suffering. In part, how do you tell whether this patient have endometriosis? if she thinks that her menstrual cramps, oh, I can live with it, I just take some Motrin, and the other patient have a little menstrual cramps and she hurts a lot. So as a doctor, we only know about what patient would tell us. However, the patient that hurt a lot may not have a lot of endometriosis, or the patient that did not hurt a lot could have a lot of endometriosis. So it's so difficult to make the diagnosis.
So what causes it? Do we know?
Genetics.
Okay.
Genetics is what I believe in. Genetics.
Okay.
So the patient's mother or grandmother, the aunt, they have all these painful period, and then they say, "Oh, my mother have endometriosis, and my aunt have endometriosis, and I think I have endometriosis." So, it's genetic.
So other than genetic, we can't nail down anything that, atmosphere or caffeine or something causing this.
Yeah, we can.
Okay. Huh.
Yeah.
Interesting.
So risk factors, I guess, you mentioned genetics. So other than family history, we don't think there's any environmental issues. Is it something that, it sounds to me like this is a subject that is maybe not always communicated because maybe the woman is self-conscious, they don't want to share a personal feeling, especially if, doctor, not to call out the obvious, but you're a physician of the opposite sex.
Yeah.
So that may be a difficult conversation to have because of maybe just the confidence that the patient might have with you. What tips would you give patients to understand at what point in time, given what you're describing, is it really a good idea to talk to a physician about the problems they're having? And when can they manage them on their own?
Well, I think there are two groups of patients. They tend to show up and seek help for those that might have endometriosis. One is that they have very, very painful menstrual cramps and sexual pain, painful sex. The other group is when they want to have baby, they have trouble. They may not have that much of a cramps and pain, then they cannot get pregnant. And so these are the major two groups of patients that would be seeking out the help. Now, I usually would get those referral for patients with painful sex and also menstrual cramps and pain in that group. To talk to the patient about the menstrual cramps, it's all individual. It's very difficult to talk about. And so you can ask them, well, do you have bad menstrual cramps? Saying, no, I just take a Motrin, I'm fine. Now, obviously, you can talk about it, and she didn't seem to be a problem. And some of those will say, well, it's getting worse now, but I take a Motrin used to help. And those are the ones have some symptom to come out to ask you some questions about the menstrual cramps. But no pain is normal, that's for sure. There's no sexual pain or menstrual pain that hurt you during the cycle is normal. And for those patients, they need to ask for the OBGYN for help.
Are there certain risk factors for developing endometriosis? I mean, I know we talked about, inherited whatever, but anything that makes it worse or
anatomy. So think about we stand upright, and if the uterus stand upright, so everything floats out.
Sure.
And if the uterus tip backward, so then the menstrual flow would not come out straight and then go back through the fallopian tube. So the menstrual blood flow goes back into the lowest part of the abdomen, we call the pelvis. So traditionally, we call those a risk factor if your uterus tipped backward. And the medical term is called rectal flex. However, if you talk about the Chinese population, and 67% of them have a uterus that tipped backward.
Jeez.
So then, do you think that they have a lot more endometriosis? Well, I think it's very difficult to prove because endometriosis, the gold standard of diagnosing endometriosis is by minimally invasive surgery. We call that laparoscopy. Put the patient to sleep, put a very small telescope and look around to see whether you find them. So that's why I make it even more difficult to diagnose, whether you have it or you don't.
What about any profession? Like, let's say a woman sits all day long in a chair. Any issues there? Or?
No, the uterus doesn't change.
I'm having a little trouble trying to figure out what happens to it when they sit.
Well, let's say your sacrum, when you sit, it doesn't change a whole lot. It's still there.
Yeah. Okay.
So that part of it doesn't change. Okay. Only childbirth can make it happen, changing the structure of the pelvis, and then the axis of the uterus tend to shift.
Why the Chinese intermarriage, or over the years, or why is that? Why do they have the back tipped backward?
Well, I think the Caucasian is usually much taller than the Chinese on the Southeast Asia, so I think that's probably genetics. The one thing that tied to some of the literature is the women with red hair. For some reason, the incidence seems to be a little bit higher in that group of population. And it all goes with genetics. Okay?
Oh, interesting. I don't know where we're at.
Well, do you want to take your break? And we'll
yeah, we
back?
can do that. We'll take our first break here. You're listening to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
Medicare open enrollment is going on now until December 7th, but selecting a plan can be confusing and stressful. That is why it is important to understand your options. We can help you figure out which plan is most economical for you. Call us and schedule an appointment to come in and have a free Medicare Part D plan consultation. Benefit from our pharmacist's knowledge, and you can save as much or more than $1,000 per year on your copays. Go to our website at medshoprx.com for more information. The Medicine Center Pharmacy's locally owned Health Mart Pharmacy in Canton, Louisville, Minerva, and New Philadelphia, caring for you and about you.
With a heart attack, every second counts. Every moment the blood supply to your heart is cut off or reduced leads to heart damage or death. Mercy Medical Center can stop a heart attack in record time. Mercy is the only hospital in the nation that can open a blocked artery right in the ER just minutes after arrival, saving lives and preventing further heart muscle damage. That's because Mercy's Emergency Chest Pain Center was America's first to achieve full accreditation and the first to install a fully functional cardiac catheterization lab just a few steps away from our ER doors. The average time in the U.S. from ER arrival to opening of a blocked heart artery is 64 minutes. At Mercy, thanks to our ER cath lab and the area's most experienced emergency heart care team, it's faster. We're capable of opening a blocked artery in as little as 5 minutes. If you have heart attack symptoms, get to Mercy. We can stop a heart attack in record time. To learn more, visit cantonmercy.org/heart.
Wendy here from Studio Arts and Glass. We're all decked out for our holiday open house going on now through Thanksgiving. A huge selection of hand-blown glass ornaments, unique jewelry handmade in the United States, glass icicles in all shapes and sizes. All at pre-season 20% discount going on now through Thanksgiving. Extended holiday hours, Monday through Saturday, 9 to 6, and Sunday, 11 to 5. Join us for our holiday open house at Studio Arts and Glass, Apple Grove and 77 in North Canton.
Hi, this is Brad White, your Medicine Center pharmacist. Are you paying big bucks for a little blue Viagra pill? There's a better alternative. Starting at only $4 per dose with a prescription from your doctor, the Medicine Center Pharmacy can prepare a sildenafil or tadalafil tablet that melts in your mouth for an affordable price. This allows you to take care of business and still have money left over for dinner and a movie. The Medicine Center Pharmacy has 4 locations in Stark and Tuscarawas counties. We're here to keep you healthy and save you money. Give us a call at 330-339-4466 for more information.
Welcome back to Health Matters with the Medicine Center Pharmacy. Today we're talking about endometriosis, pelvic pain, urogynecology, and more. Have a question? Post it on our live Facebook feed.
Okay, well, Dr. Chung has been educating us on the complications of endometriosis and how challenging it can be for a patient to deal with these problems. Doctor, is there, in summary for listeners just joining us, how about you give a definition of endometriosis for those so that we can get them caught up, and then we can talk about what we can do for therapies and to help these patients.
Okay, endometriosis patients tend to have painful periods and have, in some of them, the majority of them, if they have infertility problem, many of those patients have endometriosis. And the other group of patients have endometriosis, the group with pelvic pain, which is the vaginal pain, bladder pain, and painful sex. So these are the type of patient. Endometriosis by itself is the tissues of the uterus. Instead of shedding through the vagina in the menstrual cycle, they spread everywhere inside of the body. So causes them to have pain, including sometimes bowel issues and bladder issues.
Are there percentages? I mean, do we know how many women have this in America?
Well, in general, if you look at the literature, you say, okay, 2% incidence rate, but that is way lower than what I have accomplished in the last 20-some years in study.
Sure.
I would say probably close to 1 in 10 patients could be affected by endometriosis in the reproductive age.
And after that?
After that, the period stops.
Yeah, okay.
And there's no more of the menstrual pain anymore. So that, by definition, that stops.
So aging is a curative.
It, to a certain extent, it cures that menstrual pain, but then whatever the endometriosis have affected the adjacent organs and the nerve, that carries on.
I see.
Okay.
Yeah.
So how do we help these patients?
Well, I mean, when a patient come in and talk about, well, my menstrual cycle hurt, and most of the gynecologists would say, okay, try some birth control pill. Well, I don't want them to call that birth control pill, which is hormonal manipulation. Basically, have them take the hormones to make the symptom less. However, we talk about it. That's not endometriosis. That may not be endometriosis. That may be just a painful period. So to make a diagnosis of endometriosis, have to go through surgical. Okay? And when you make the diagnosis endometriosis, you're supposed to remove them in the pelvis. So surgical option is the gold standard, and you remove the endometriosis when you see them through the tiny little keyhole incision. Either you can use laser and cautery, some heat source, and just burn them off. But burning them off, patients tend to have recurrence much quicker than you completely excise it. And excising the endometriosis is a little bit more difficult. So the appearance of the endometriosis, for example, analogy, you go to the beach, use your hand, grab some sand, and then come back, you throw the sands on the table. That's what you're going to find endometriosis in the pelvis. So it could be on the bowel, bladder, and you burn them, and it's not easy to burn, and because sometimes injury can occur during the treatment. So that's the gold standard, and you remove them and then give them some hormones and some specific medication to treat endometriosis, and that seems to control it. You can never cure it. I think you can remove all the endometriosis when your expert surgeon just cut out every little pieces that you can see. But then scar tissue can happen, right? So that's like pros and cons. And when you do that, you think you can remove all the endometriosis by the best surgeon, and you remove the deep endometriosis. They invaded all different areas. But this patient could come back for more. And I have patients say, oh, I have 10 laparoscopy. I have 5. I've still hurt. So can you do one more? I say, no. That doesn't mean that you have endometriosis. And many of these patients have multiple surgical treatment, and they're still not better. And that's the biggest point. Patients have endometriosis, have the menstrual pain, sexual pain, but there are so many other organ systems inside your pelvis. By definition, is anything below your belly button. So I hope that I can answer you, because it's just too much involvement in the entire area. So patients with endometriosis, they have the painful condition in the reproductive system, but it's connected to the nerve of the bladder, connected to the nerve of the muscles, connected to the nerve of the sacrum. And so when things hurt, the nerve will tell the other area, you're hurting too. So it turns into all these connections like computers. And this computer is not working, that shuts out this one and shut out that one, and then make the main computer just fire up, and all of a sudden everything is not working.
You're not painting a very good picture for help here.
It is.
You got it. You live with it, I guess, huh?
Well, I live with a lot of patients have this condition. Now, the simple one, if it's just minor, they get better.
Okay.
And then they may have recurrence. It is not a simple condition to treat. And so far, that's why there were so many failure. And
I can see it be very disrupting to their lifestyle too. So whether it be work, family, leisure, anything, so you could be really, it'd be a real challenge to manage. So
yes. And you think about, I would consider the woman is the head of the household, and everything is going through the mother and the children. And if the mother is not happy, the kids are not happy, the husband not happy, and nobody happy in that household. And if that's going to be happening 2 or 3 weeks out of a month, it's not fun.
And she's not happy either. So
we need a pill here for this or something.
I know, we are looking for a magic pill.
Or something like that. I mean, this is something that, okay, we made progress in cancer, we made progress in many other disorders and things like that, but this doesn't sound like we've made a heck of a lot of progress.
You're right, because somehow the woman got forgotten. And so you see that in March is a National Month for Endometriosis. And this condition is just keep going and going and going. And now it's more obvious women have a voice and that we pay more attention. But again, we still have not got to that stage that we can just stop it.
Amazing. Okay, second break is here. You're listening to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshoprx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
we understand the one-size-fits-all approach doesn't always work. We do customized compounded medications based on your doctor's prescription to match your specific needs. Hi, I'm your pharmacist, Brad White from the Medicine Center Pharmacy. Do you use or need customized compounded prescription medications because of allergies, special formulations, or need an easier way to take your medication that isn't available? Many physicians choose to prescribe a medication that is not commercially made and requires a pharmacy like ours with special equipment and training to prepare a capsule, suspension, cream, or tablet. Are you sensitive to lactose, dyes, or need a sugar-free suspension? The Medicine Center Pharmacy is here to help you. Every day we prepare custom medications for infants, adults, and pets in our PCAB accredited compounding lab. Call or stop by the Medicine Center Pharmacy today at 551 West High Avenue in New Philadelphia, where wellness begins.
Medicare open enrollment is going on now until December 7th, but selecting a plan can be confusing and stressful. That is why it is important to understand your options. We can help you figure out which plan is most economical for you. Call us and schedule an appointment to come in and have a free Medicare Part D plan consultation. Benefit from our pharmacist's knowledge, and you can save as much or more than $1,000 per year on your copays. Go to our website at medshoprx.com for more information. The Medicine Center Pharmacy's locally owned Health Mart Pharmacy in Canton, Louisville, Minerva, and New Philadelphia, caring for you and about you.
Wendy here from Studio Arts and Glass. We're all decked out for our holiday open house going on now through Thanksgiving. A huge selection of hand-blown glass ornaments, unique jewelry handmade in the United States, glass icicles in all shapes and sizes. All at pre-season 20% discount going on now through Thanksgiving. Extended holiday hours, Monday through Saturday, 9 to 6, and Sunday, 11 to 5. Join us for our holiday open house at Studio Arts and Glass, Apple Grove and 77 in North Canton.
Hi, this is Brad White, your Medicine Center pharmacist. Are you paying big bucks for a little blue Viagra pill? There's a better alternative. Starting at only $4 per dose with a prescription from your doctor, the Medicine Center Pharmacy can prepare a sildenafil or tadalafil tablet that melts in your mouth for an affordable price. This allows you to take care of business and still have money left over for dinner and a movie. The Medicine Center Pharmacy has 4 locations in Stark and Tuscarawas counties. We're here to keep you healthy and save you money. Give us a call at 330-339-4466 for more information.
You're listening to Health Matters with the Medicine Center Pharmacy. I'm your host and pharmacist, Paul White. Today we're talking about endometriosis, bladder issues, and treatment options with Dr. Maurice Chung, Director of the Mercy Center of Endometriosis, Pelvic Pain, and Urogynecology at Mercy Medical Center. We've got a lot more to cover this morning, so let's get back to the show.
Okay, Dr. Chung, you've been explaining to us what solutions and treatments you can perform for patients that are suffering from endometriosis. And you've also shared that it can be very difficult, even after multiple surgeries, to help a patient solve their problems. So you have a patient, let's say, that has had multiple surgeries, and you've done the best you can do to clean up this damaged tissue. What do we do next?
Well, depends on her symptom, because we talk about that. You have to ask the patient. And as most of us as gynecologists, when we were trained and we don't know too much about the bladder or the other area in your pelvis, which is below the umbilicus, not the bone. So when we start asking patients with endometriosis, many of them have urinary urgency and frequency. And they get up in the middle of the night and they have to urinate more than twice or 3 times, and after they urinate, then they say, oh, well, I'm not empty, I got to go back there again. So this symptom comes in with the bladder because maybe the bladder have an issue of themselves, or the nerve was irritated by the menstrual cycle, and the symptom get worse. So they define the condition of painful bladder syndrome that goes along in the pelvic pain. And patients have endometriosis, and I would say 70% or 80% have the painful bladder syndrome. As a matter of fact, patients with pelvic pain, and all these publications back in the 2000, 85% of those patients have a painful bladder syndrome. So think about it. If you have endometriosis, you think you have endometriosis, but then you have painful bladder. So if you just go after the painful symptom of the menstrual cycle, you miss the bladder symptom. And so for me, that deal with women with pelvic pain, I would ask about those, whether you have the symptom of the bladder. In fact, it's the nerves. However, when women after childbirth, that affect the pelvic floor, they could damage it, they could tear it, and they could stretch the nerve, and now you have the pelvic floor muscle spasm or the pelvic floor weakness that define what we call pelvic floor dysfunction. So you have a woman with endometriosis, pain get worse during the cycle, the bladder is hurting, the muscle is having spasm, and here sometimes is a little bit weak during the time that is not having the menstrual cycle. And you have some urinary leaking, incontinence, and so all these is an entire, I call that a burning inferno. If the endometriosis is one of the neighborhood house is burning, the bladder is right next to the uterus and is your neighbor. When your house catch fire, your neighbor house is going to burn, and your neighbor house of the neighbor house is going to burn. And then all of a sudden the entire residential area, that becomes an inferno. So when you treat endometriosis, like putting off the fire of one place, oh, well, it's not going to work because the other is still burning. So you're going to go right back and have to put out all the fire. And don't let the ashes start burning again. So that is the whole concept of treating pelvic pain. It's not one condition, it's the entire pelvis. So
it sounds like from our discussion at our last commercial break off the air that your particular specialty helps a patient, and you can help a patient deal with all these areas, whereas in the past, if I'm understanding correctly, the patient might have had to see 2 or 3 different specialists. Am I right?
yeah, say you're a gynecologist, you deal with endometriosis pain. However, when the nerve is not working well, your bladder is in trouble. Then you have the bladder problem. Then you want to see a urologist. So what happened to your muscles? The muscle spasm. Oh, now your bowel is in trouble, and you get irritable bowel. Then you have loose stool, you have constipation. Then you're going to see a gastroenterologist. So when everything else in your basement is hurting, the noise is going to be heard from the first floor, which is the abdominal muscles, and it keep going up. The entire body is hurting. Then you have these patients have fibromyalgia and migraine headache.
There's an analogous situation in men here. The prostate gland. Okay, it's almost
Actually, men have the same problem.
Yeah.
If the prostate giving urgency and frequency, you remove it. What if those patients, after the prostate was removed, they still have urgency, frequency because the bladder is right next to the prostate?
Sure.
You see what I'm saying? Is your house is burning. Somebody's also burned too.
We got to fix some of this stuff. This is kind of.
Oh well, I'm trying to devote my the rest of my career to try to help out. That's what I would want to do.
I mean, I will tell you that our stores sell a monstrous amount of underpads and diapers, adult diapers. It is just bizarre to how many we do sell, and I never realized how bad or how many women, men, whatever, had issues, bladder issues or whatever was related to what we're talking about today.
Yeah.
It's just amazing.
It is. And you think about that. 1 in 3 patients, women, now at least it's gynecology, they are committed to nursing home because of the urinary leakage, uncontrolled loss of urine. So, and many of those, by then it's too late to treat.
Sure.
And they end up with a catheter. And then you have hygiene, you have urine soiling, then you have odor, everything else goes along with it. And urinary leaking is, if you started to pay attention to them, and you can stop them, and it's treatable. And the other condition that I deal with a lot is when women have childbirth and their organs, let's say the vagina, the muscles, and the uterus, they evert it like a pillowcase hanging down outside of the vagina. And so those are called the genital organ prolapse. Now that's treatable. And what it is those patients with urinary leaking, prolapse organ, that's a damage of the pelvic floor, all the muscles and nerves. So, which is no surprise, the patient would have the pelvic pain that goes along with it because of the nerve was agitated. And then it connected to the bowel, connected to the bladder, and is the entire pelvic floor, the pelvis.
Okay, we see some prescription drugs that supposedly, for a better term, dry up the bladder. Okay. I can't think of any of them off the top of my head. There's 2 or 3 out there.
Oh, yeah. There are a lot of these medication which is not new. The earliest one came out in 1993. That's called the tolterodine, the Detrol. And before that is oxybutylene. And many of these medications causing dry mouth. And the older the person, the more trouble with the brain with all these medication side effects. And almost all these medication have the side effects of the anticholinergic side effects. So they have dry mouth, they have constipation, And for incontinence, for the early one that puts on this medication, they have improvement. And it works very well for them. And the urinary urgency frequency, however, is not so much that could be helped by this medication because it's only improved by 25%. And so they are more into this medication why patients stop taking them. And it's because of the condition, the underlying condition was not treated. Instead of giving you a Band-Aid for going to urinate a few more times. So that's what I call the pelvic floor dysfunction, the pelvic pain, and the entire pelvis. It all have to be looked at.
Well, many of these meds out there for that and for blood pressure and other things have practically created a whole new department in our stores for, like the item that I gave you, dry mouth. I mean, it's ugly when you wake up in the middle of the night and you can hardly open your mouth, and that's how dry, it can get.
Well, yeah.
So we end up treating another issue if we give them a product that basically dries up their bladder, and so it's just
where you get started and to treat them, and you say, okay, well, you have dry mouth, and just do some chewing gums. Well, you can't if they have denture.
While you're sleeping. I know, but
so it doesn't work. And so when these medications fail, and we have a newer medication, which is a little procedural, and is a botulinum toxin. We use it to cosmetic take away this chlorpheat, and we can inject it into the bladder and paralyze the muscle so you don't leak. And then there are other treatment using pacemaker, using some kind of electrode putting into your sacral nerve, and you stimulate it and paste it so that you don't leak. But those are surgical procedure. As I said, if you have this problem, if you seek help early, you don't have to go into all of these. Now, this is for the type of condition that you have to go, you cannot make it to the bathroom. It's not the type of condition that when you cough and sneeze, then you leak urine. And it's not the same as I'm going to the bathroom a lot and I cannot empty. So there are so many different conditions that require different treatment.
Okay, final breaks here. You're listening to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
The warmer weather is here. Hi, this is Brad White from the Medicine Center Pharmacy. Perhaps you've gotten the urge to venture outside and clean up the garage or do some yard work, resulting in muscle aches and pains. If you have sore muscles or aching joints, you may want to consider a prescription pain-relieving cream available with a prescription at the Medicine Center Pharmacy. Our pharmacist can work with you and your physician to get topical pain creams that can be rubbed directly on the source, reducing inflammation and pain. Topical creams avoid troublesome side effects and dependency issues that can be caused by oral medications. The Medicine Center Pharmacy has an accredited compounding laboratory, and it is your source for custom medications. Custom compounded pain-relieving creams, available only at the Medicine Center Pharmacy, where wellness begins. Visit us at medshoprx.com for the pharmacy nearest you. That's medshoprx.com.
With a heart attack, every second counts. Every moment the blood supply to your heart is cut off or reduced leads to heart damage or death. Mercy Medical Center can stop a heart attack in record time. Mercy is the only hospital in the nation that can open a blocked artery right in the ER just minutes after arrival, saving lives and preventing further heart muscle damage. That's because Mercy's Emergency Chest Pain Center was America's first to achieve full accreditation and the first to install a fully functional cardiac catheterization lab just a few steps away from our ER doors. The average time in the U.S. from ER arrival to opening of a blocked heart artery is 64 minutes. At Mercy, thanks to our ER cath lab and the area's most experienced emergency heart care team, it's faster. We're capable of opening a blocked artery in as little as 5 minutes. If you have heart attack symptoms, get to Mercy. We can stop a heart attack in record time. To learn more, visit cantonmercy.org/heart.
It's that time of the year again. It's time to protect your family against the flu virus. Hi, this is pharmacist Paul White from the Medicine Center Pharmacy. Flu vaccination should be a priority to you and your family, so take the steps today to protect yourself. Visit us at any Medicine Center Pharmacy and get your flu shot. And don't forget to stock up on items to boost your immune system like probiotics and multivitamins. Medicine Center Pharmacies are conveniently located in Canton, Louisville, Minerva, and New Philadelphia, where wellness begins. Welcome back to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White. Today we're discussing pelvic floor dysfunction, diagnosis, and treatment with Mercy Medical Center's Director of Endometriosis, Pelvic Pain, and Urogynecology, Dr. Maurice Chung. So let's get back to the last segment of our show.
All right, Doctor, we've been talking about a lot of problems, and you've been offering solutions or treatment plans. How about, can you speak to patients that are struggling with some of these things, and especially the bladder issues? It sounds like with the bladder issues, there's a lot of options. Yeah. So don't be afraid to talk to your physician.
Exactly. So let's start out with urinary symptoms. And when you have to go to the bathroom a lot, and when you don't feel that you empty your bladder.
How about this, not to interrupt? What do you consider go to bathroom a lot? And I'm just curious, given some people might think seven times a day is normal, but I'm guessing it's not.
Well, that's a very interesting question, and you asked the right question. Back in 1993, before all these, we talk about that, and somehow, somewhere in the nation, we define that more than 8 times a day and more than 2 times a night. So when you think about it, there's only 24 hours. And if you go 10 times, so every 2 hours you have to go. So that becomes a lot.
That is a lot.
Yeah, 10 times. Just only 8 to 10 times, that's already above. So when you have to go, that's called the frequency. However, frequency depends on how much fluid that you drink.
Sure.
And then if you drink, let's say, a gallon, and you go 10 times, and then you empty 400 cc, which is probably close to a can of soda every time, then you're fine because you put out all the fluid that you put in. But if you drink about 1 16-ounce or 2 16-ounce water a day, and if every time you go, you only put out maybe 2 or 3 ounces, now that's abnormal.
That's a problem, yeah.
So it's not so much about how often you go, it's also how much you put out. And of course that we know that the more you drink, the more you go. The more you drink, the more you leak urine. So drinking too much water doesn't mean it's all good, and you just have to be just right. And so treating urgency, frequency, you don't empty, is the bladder nerve issues. There are some medication and some condition, and leaking urine without knowing, and sometimes you have to go, you cannot make it to the bathroom, then it's important that you start the treatment early because it will get to the situation that you're leaking all the time. So any urinary leaking is not normal. And just using the diaper or some depend to stop it, it is not healthy because that urine soiling that can cause infection of the vagina. And think about if your toilet, you go and pee and not flushing it, and then you see all the stain on it, and that's what the urine could do to you, your body.
So the caffeine's an issue too. Isn't that a xanthine? There's like theophylline and a couple of other things.
Well, the caffeine is just one of the chemical compound of a group of medicine called the methyl xanthine, and you have the theophylline in it. You have theobromine, which is cocoa butter. You have caffeine, and
we Americans consume a ton of caffeine. I mean, it's just nuts. Coke, Diet Coke, coffee, tea, all that kind of stuff.
You mentioned that caffeine is the worst enemy for anyone with bladder issues.
Sure.
Yeah, and caffeine's the way how caffeine works, and no matter what medication you take, it's not gonna work when you're on caffeine.
Interesting.
Yeah. So that's the type of condition, urgency, frequency, and leaking that you have to go. You cannot make it to the bathroom. But then the type of leaking urine, when you have cough and sneeze, a cold, now that's is the weakness of the pelvic floor. And Kegel exercise, it works only when you do them. It's not a treatment. So there are surgical procedure to help out with that condition. Because you don't want to be the one that planned the entire day to, let's say, going out to shopping, and in the mall, that bathroom is that corner and the other bathroom is another corner, and then that the back of the store is another bathroom.
Yeah.
So when you drive and go to visit somebody on a highway, you know exactly where the rest areas are. Now, that is not normal, because you shouldn't have to think about that. Your body's supposed to be able to control.
So what we're saying here is the person that has bladder issues should decrease the intake of liquids.
Well, you can't just decrease to nothing.
Well, no, that's right. I mean, that's exactly where I'm going. We get all these things in the news. Well, you should be drinking 6 gallons of water a day, or whatever the case may be.
I would say about 1.5 liters to 2 liters, which is half a gallon, a little bit less.
Sure.
That's the rule. If you drink less, 25% less of the fluid intake, then your urinary leaking would drop by half.
Okay.
Now, another thing is weight. The body weight. You gain weight, you leak urine with coughing and sneezing. If you lose 10% of your body weight, the leaking would drop by close to half. So the weight control is important, the fluid control is important, and the brain control is even more important. You have to change the behavior of drinking water. You have to avoid certain things that make you pee a lot, and you have to hold a little bit longer if you want to go, but then you really don't have to go, and just don't go. And so these are some of the management, non-surgical.
Are you suggesting that you can kind of retrain the bladder sphincter muscle innervation, whatever the case may be?
Yeah, it's the condition of the brain. Okay. So urination goes through the urination center and through the brain. So the brain plays a big role in controlling the leaking.
So we go to the psychiatrist instead of the gynecologist.
And as a matter of fact, there are some neurochemical disorder conditions that make the treatment a lot more difficult. Remember the lithium on patient with bipolar disorder, they really make the patient pee a lot. So then you have that, then you have this condition. So it makes an impact on the life of the patient regardless. We haven't even got a chance to talk about the pelvic organ prolapse. Maybe some other time we can talk about that.
Okay.
And in a nutshell, pelvic pain, menstrual pain, bladder pain, muscle pain affect the woman's life a lot. And it's not one single entity or one target organ. It's the entire pelvis. And when patients have pain, which is not uncommon, they have urgency frequency. And when they have urgency frequency, when the nerve is not working very well as they get older, then they have urgency and they cannot control the leaking. So everything ties together. It's the nervous system.
Amazing.
I don't want to get old.
Well, I guess the man is a little bit better. They're immune to many of these.
Yeah.
But then you talk about women. Men have pelvic pain too. Many of these bicycle riders, they have this pudendal neuralgia. And women have pudendal neuralgia more than you know. And so I did a study back in 2009 patient with endometriosis, they have a lot of pain and they have pudendal neuralgia. And so those patients with pudendal neuralgia, in the beginning you asked about, well, what about they sitting? Yes, the longer they sit, it hurts. Standing, it hurts. They only get better when they lie down. And men have the similar thing, although they don't have such a complicated. Men is simple, all right?
Sure.
So women is a lot more complicated, down in the pelvis.
Wow.
Okay, guys, it was a wonderful show today, and we appreciate you coming by, Doctor, and we'd like to have you back again.
My pleasure.
And being from Ohio Northern, and you've been there, and it's kind of interesting also. Okay. So thank you to our special guest today, Dr. Maurice Chung, Director of Mercy Center, Endometriosis, Pelvic Pain, and Urogynecology. We'd like to remind our listeners, if you suspect you have a medical issue, please contact your healthcare provider. Thanks to our sponsors, Mercy Medical Center, Studio Arts and Glass, and of course our technical producer today, J.D. DeAngelis. As always, we thank our listeners for joining us on Health Matters with the Medicine Center Pharmacy. We are a local Health Mart pharmacy, caring for you and about you. Have a healthy week, and you see you again next Friday right here on News Talk 1480 WHBC.
Thank you for joining us for this edition of Health Matters with the Medicine Center Pharmacy and your hosts, your pharmacists Paul White and Brad White. Remember, you can get more information right now at medshoprx.com. That's medshop.rx.com. Be sure to join us next Friday at this time for Health Matters with the Medicine Center Pharmacy. The preceding program was sponsored by the Medicine Center Pharmacies.